Welcome back to Body Beautiful. With us today we have plastic surgeon Dr. Joseph Mele, and we're talking about breast augmentation and the brand new FDA approved implants. Later we'll be taking your calls, answering any questions you might have. Here's the phone number, 415-561-8753. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And any information we give you, it's about as good as you can get, but we advise that you always check. You know,
it's always good to get more than one opinion.
Yeah, always good. So how does a person select a breast implant? I mean, you brought several examples here.
Sure.
And, I mean, is it just like that? I'll take this one, that one, or that one?
I depend on my patients to let me know what they're trying to achieve and where they want to be. So if they're a A or B cup, they want to be a C. I appreciate that information because it makes me think they've thought about it. And they may even tried on a bra and stuffed it out. All those things help so that you're comfortable with that size. The most common reason to re-operate on someone with breast implants is to put a bigger implant in. So it's good to know what size you want to be and what's going to make you comfortable. Obviously, we don't want to overdo it, but at the same time, I don't want to feel like I'm not doing enough. Now,
we've had some callers, some gentlemen who were calling, and they were inquiring about size. Do you find that, do women do this for themselves? Do they do it for the man in their lives?
No, the vast majority of women, they value the man in their life, but that's not why they're doing it. They're doing it for themselves. And a lot of times it's just so that their clothing fits. Maybe they were larger and had children and lost volume and want that back. But it's for themselves. I think that's really the only good reason to do it. Okay. You brought some examples here, and we showed off a few of them. I did. I mean, we talked about the shape. Excuse me. You were asking about the filler and what's different. Yeah. So I put a little cellophane on here just so I don't get stuff on your desk here.
Oh, thank you.
But if I squeeze this, you can see the gel will come up, and then if I let go, it falls back inside. And it's not that this is holding it. I can take this off.
Right.
You know, it'll stay stuck. But
so for those people who are concerned about
the shape will change and then go back to the original shape. So it doesn't run like water.
Well, yeah. So for those people who are concerned about migration and so
right. The older implants, if I had done this, it would have just splashed on the desk. It would run. And with the saline implants, even a pinhole is enough to let all of the gel out. Whereas these, if they have a small hole in them, may mushroom out the hole, but it's going to basically suck back inside the majority of the time.
Okay. And you also brought one that shows how a reconstruction.
Yeah, this is for breast reconstruction. So it's an implant that has a port, and this one happens to have two ports because you can, like these implants, you can stretch the lower half out
So this
more.
is for someone who maybe had a mastectomy?
Yes, or for congenital problems, someone born without a breast. We're trying to stretch that skin out and give them enough coverage so they can have an implant that matches the size of the opposite. Okay, so that's inserted like that, and then you just sort of like a tire, pump it up? Kind of, yeah. This has little patches on there so you can hold it in place, keep it from rotating. It has a main port that fills the bigger part of the bag, and then another port out in front that allows us to preferentially fill out the lower half, and that lets us stretch out that skin at the bottom. It's usually placed at the time of a mastectomy, and it's inflated to whatever volume we can put in comfortably. And then once that's healed, we'll put in more fluid through these little ports in the front. So it does take a little injection in the skin that lets us go into the port, which is metal on the back, so it can't poke the implant. And we just slowly, gradually add fluid until we get a little bit bigger than the size that we want. Now, I hope this isn't off topic, but for those who've had reconstruction after a mastectomy, there are varying approaches to this. Some people say, as soon as the tissue is taken out, to go ahead and do the replacement on the spot, so you never experience. Oh, and the advantage is, psychologically, there's always breast. It's never flat. Because it can be very devastating. The disadvantage is sometimes with more aggressive tumors, we don't want the implant in the way while we're treating the cancer. We want to be able to monitor for signs of recurrence. So sometimes delaying is a good idea too. Okay. Now, as the surgeon, I'm so curious. I mean, how are these inserted? Oh, they're put in through a small incision. So the majority of the time with the gel implants, we're either going underneath the breast through the inframammary fold or around the areola if the areola is large enough to let us put these in. But there is a minimum size to the incision. If I try to put a large implant through a small incision, I'm going to be stretching the shell out. And if I stretch it too much, I may make a weak point, and it's going to be more likely to leak. Okay. With these highly cohesive gels, it does require a little bit bigger incision because it's a little bit stiffer. And you mentioned that the shaped ones, the natural shaped ones, were around in the 60s, but they were attached with a little patch. Yeah. How are they attached now? Well, now part of it is just making the pocket that's the appropriate size. So you want a pocket that's just big enough, but not too big to allow it to spin. And then the surface of this is textured. It's fuzzy. So again, it's like Velcro, so the scar will attach to it. And once it's attached, it's hard to make this slide.
Okay.
So what it would like to do is it likes to put the big end towards the side, just like when you lay down, the breasts tend to go to the side.
Okay.
This is to discourage it from doing that.
Okay.
But it is a problem, and it is something that can only happen with these implants, whereas if it changes, it may require surgery to rotate it back. Whereas the round implants, they can turn and turn, and it gives us the same shape.
Either way. Well, for more information about Dr. Mele, you can call him at 925-943-6353, or check him out on the web at either drmele.com, sanfranciscobreast.com, or at sanfranciscoplasticsurgery.com. When we come back, we'll continue our chat about breast implants, and I promise we'll take some of your calls. That's next.